Hi there, my name is Madeleine Gearside and I am a Policy and Development Officer with Carers New South Wales. I co-authored this presentation with my colleague Melissa Docker, and today I'll be focusing on carer respite, the key to a sustainable aged care system. So I would of course like to start by acknowledging the traditional custodians of the lands from where we're meeting on today. For our North Sydney office, they are the Gorogal people of the Eora Nation. And I would like to acknowledge the custodians of the lands from where you are joining and pay my respects to elders past, present and emerging, and extend that respect to any Aboriginal people joining today. So just briefly, Carers New South Wales is the peak organisation for family and friend carers in New South Wales. And our vision is for an Australia that values and supports all carers. In terms of our definition of carer, we define a carer as anybody who provides care and support to a family member or friend who has a disability, mental illness, drug or alcohol dependency, chronic condition, terminal illness, or who is frail-aged. So our definition doesn't include paid care workers or formal volunteers or foster or kinship carers. And at the moment, there are approximately 854 3,000 carers in New South Wales. This presentation will draw on published studies about carer respite in Australia, along with data from the Carers New South Wales 2018 Carer Survey and 2020 National Carer Survey, to highlight the experiences of carers in accessing respite care within the aged care system, and the subsequent impacts on carers' mental health and wellbeing and the caring role. It will also draw on Carers New South Wales' experience delivering a range of programs to carers in New South Wales, including emergency respite. And the research and statistics which have informed our work on respite have drawn from studies conducted by members of Carers New South Wales Carer Respite Alliance. The Alliance was established in 2017 and is made up of peak organisations, service providers and university research centres that either deliver, broker or evaluate carer respite in New South Wales. The key studies from that group are listed in the references slide at the end of this presentation. So as we know, aged care has undergone major reforms throughout the past decade. Changes have included a shift towards consumer-directed care, where care is assessed in relation to the needs and choices of care recipients. And whilst we acknowledge this is a really important shift towards autonomy and supporting independence, in many cases this focus has actually resulted in an unintentional shift away from carer needs. Within aged care, the concept of respite has actually remained fairly stable in spite of ongoing reforms, and it refers typically to a specified range of more traditional services providing replacement care while carers attend to other activities. While many carers actively choose to provide care, without opportunities to take a meaningful break to manage their own health and wellbeing, carer physical mental health can suffer, as well as physical health and the sustainability of the caring role. Formal care services and carer-focused wellbeing activities provide many carers with the much-needed break, but research is indicating that many carers are limited in their access to respite due to significant wait times for services, high co-contributions, and limited consideration of carer needs within care planning. Recent reform of the carer support sector as well, including the launch of in-person supports under the Carer Gateway in April 2020, has again brought the concept of respite to the fore. Emergency respite has been carried across from prior models delivered by Commonwealth Respite and Care Link Centres, or CRCCs. However, it is considered to be a crisis support within a holistic service model focused on early intervention and prevention. Planned respite is within scope, but funding is capped and tied to specific objectives. So it's not intended to be either universally available or regularly accessed by carers in an ongoing capacity. While carer supports exist, it is the role of the aged care system to provide planned and ongoing respite for carers of people who are ageing, and the success of carer supports as a whole is dependent on the aged care system fulfilling this role. So aged care is actually the only sector in which an entitlement to respite is embedded in legislation. The Aged Care Act 1997 and the associated Aged Care Principles 2014 outline the provision of respite as a legal obligation. The definition is up there on the slide, and the Aged Care Principles 2014 dictate that older people can access up to 63 days of funding for residential respite per calendar year. While this entitles a maximum amount of respite provision for administrative purposes, it doesn't necessarily guarantee this level of support, and that's often led to disappointment and confusion among carers attempting to access a very constrained aged care system. The Royal Commission into Aged Care Quality and Safety has emphasised the inability for carers to access adequate and appropriate respite within the aged care system. And it's been noted that while current carer support system reforms will aim to address some carer needs, there's an expectation that the aged care system will continue to provide some carer-directed supports, including planned respite. Throughout proceedings, however, it's been identified that the current aged care framework does not enable or promote this. So this slide features a word cloud made up of some of the key benefits of respite. In aged care, respite as a service type currently includes residential respite, community respite such as cottage respite, flexible respite, and additional supports. In addition to aged care services labelled as respite, other CHSP and HSP services such as social support, domestic assistance, personal care, and allied health treatments can also offer a potential respite effect. Despite the relative integration of respite across the aged services sector, the breaks provided to carers tend to be quite short, and lots of carers are reporting that respite services are not providing the levels of consistency or frequency to allow them to engage in regular paid work. In spite of the difficulty of identifying and measuring outcomes for respite, commonly identified positive outcomes include improved health and wellbeing for carers, increased social and economic participation, strengthened personal and community relationships, increased time for carers to look after themselves, and also enhanced autonomy and independence for the care recipient. We know that respite is most effective in reducing carer stress and increasing the sustainability of caring arrangements when it's accessed early and regularly. So the Carers New South Wales Carer Survey was national in scope for the first time this year, and the survey was collected information about carers across Australia to inform our support and our advocacy across New South Wales to carers. It focused on experiences of different sectors, including aged care, carer health and wellbeing, carers' involvement in paid work, and also just the general characteristics of carers and those they are caring for. And while the survey is not representative and findings should be generalised with caution, it's a great instrument in generating data that focuses in depth on the insights and experiences of carers. So the demographic characteristics of the 2020 sample, we received 7,735 valid responses to the national survey in 2020. The typical respondent was a female primary carer of working age with a high school education, but not participating in paid employment. A range of carers from different cultural backgrounds, of different sexualities, ages, and socioeconomic status responded. And respondents came from every state and territory in Australia and from across both metropolitan and regional and remote areas. In terms of the respite specific data indicated that carers across all age groups spent on average 13 years and 74 hours per week caring. 70% of care recipients represented by carers completing the survey could not be left alone for more than a few hours, and approximately 43% of carers indicated that they never got time out from their caring responsibilities. The graph depicted here shows that of the total number of respondents, 6% of carers were using emergency respite and nearly 40% would like to be using more. and 14% of carers were using planned respite, and 40% would like to be using more. I think it's also important to note that 30% of carers had a long-term illness or disability themselves. So it's quite important to consider the health impacts to carers living with an illness or disability where they're not receiving a sufficient break from the caring role to address their own needs. And this might be exacerbated by the fact that carers commonly neglect their own health to put the needs of their care recipient ahead of their own. If a carer or family member is not supported with providing ongoing unpaid care, there is the risk that they will become burnt out or overburdened, which can lead to a breakdown in care arrangements or disengagement from the caring role. And this can even result in premature residential placements or substantial community care costs. In terms of the access barriers in relation to respite, availability is a concern, and limited availability can be the direct result of high costs of providing respite, limited financial support for providers to meet overheads, reduced financial security in market-based systems, which creates financial disincentives for providers, the unpredictability of respite vacancies, and the tendency to view respite as a means to trial residential care rather than to achieve a set of outcomes. The awareness of respite is also a barrier. Carers' understanding of what respite involves and their entitlement to it is very varied, and this is a particular issue for special needs groups, including culturally and linguistically diverse carers and older carers. We know that carers are time poor, and this reduces their capacity to seek out various respite options, and inconsistent information can create confusion. Accessibility is another barrier, particularly the digitalisation of services, including My Aged Care, which relies on the assumption that carers are digitally literate and have access to the internet and appropriate devices. A recent study found that only 25% of carers had utilised My Aged Care, and those who did not rate it as a useful source of information. We've also seen that consumer-directed care has resulted in increased service gaps and complex systems which many carers require assistance navigating, including when they're navigating that for the person they care for. The appropriateness of respite is a barrier. Some supports that provide respite lack the flexibility and responsiveness required. Some options are not suited to the care recipient, for example, residential respite for a younger person living with a disability. And carers report wanting to feel confident in the quality of respite care provided to their loved one, and this isn't always the case. And finally, affordability is a barrier. A lack of financial incentive to provide respite services impacts on supply and demand. There's sometimes a lack of cost transparency across the ageing sector, and overhead costs for accessing respite services increase considerably compared to non-respite supports. So in terms of where to from here, the national aged care reforms continue, and these provide a real opportunity to improve carer health and wellbeing outcomes, increase longevity of the caring relationship, and supporting carers to have a break from the role by broadening the definition and understanding of carer respite. The ongoing lack of availability of beds within residential aged care facilities, the lack of infrastructure to facilitate access to cottage respite, and extensive wait lists for home care packages continue to jeopardise access to respite for carers as well. Carers are reporting that services are often inappropriate or inadequate to meet the needs of their care recipient, and we know that respite is even more pressing due to the pandemic, with reduction in formal and informal supports paired with an increased caring role for many carers. And this is likely to have a flow-on effect on respite demand as carers are needing a break and are reaching breaking point. Carers New South Wales continues to advocate for capital investment in respite infrastructure, particularly cottage respite models. And the council assisting for the Royal Commission into Aged Care have emphasised that the government should fund capital to enable the establishment of physical infrastructure in areas where there is unmet need, and that new respite services should be built in consultation with carers and the Carer Gateway. The current review of residential aged care assessment and funding tools also provides an opportunity for the place of residential respite in the carer support landscape to be considered and refocused. Increased market data will strengthen provider confidence and encourage them to invest in areas of need. And investment in activities that are focused on wellness and reablement, such as those provided under the CHSP, have the dual benefit of providing carers with a break while increasing the capacity of the older person participating in the respite. Finally, an adequate supply of skilled, quality workers and coverage in thin markets are current major priorities in the aged care sector. More quality and diversity of workers, especially where options are currently limited, will improve the availability of respite offerings to carers. And that's my reference list at the end. Thank you for your time. Take care.